Welcome to our 2020 Benefits Annual Open Enrollment Period. This is the one time of year you are able to enroll in or make changes to the benefits offered to you by Natural Grocers. The open enrollment period will be from November 11th to November 22nd. The topics we will be covering: who is eligible, overview of 2020 Natural Grocers benefits, what's changing in 2020, enrollment information, important reminders, and questions and contacts. Who is eligible? Crew who have been full-time for at least 60 days are eligible to enroll in benefits during the annual enrollment period. You must work an average of 30 hours per week to maintain full-time status and benefits eligibility. Any full-time new hire and crew who move to a full-time status later this year or next year will have an opportunity to enroll in benefits at that time. Natural Grocers offers a variety of benefits, and this chart lists what those benefits are. You have optional benefits, which are the benefits you may choose to enroll in. These include medical, dental, and vision, health savings accounts, the various flexible saving accounts, voluntary life insurance, long-term disability, the AFLAC accident and hospital plans, and 401k. As a reminder, crew are automatically enrolled in the 401k when they become eligible. 401k elections can be changed at any time during the year. Natural Grocers also provides some additional benefits at no cost to you. This includes $25,000 in basic life and accidental death and dismemberment coverage, short-term disability, and the Employee Assistance Program. Just so you know, the Employee Assistance Program is available to all crew and their dependents, whether they are full-time or part-time. We will discuss the EAP in more detail later. What's happening in 2020? We have some important changes. Medical and dental, along with short-term and long-term disability and life insurance benefits, are moving to Cigna. The short-term disability plan will be enhanced, providing a shorter wait period of 7 days. For life insurance, previously eligible crew are able to newly elect or increase their voluntary life benefits without completing a statement of health up to the guarantee issue amount. Our Employee Assistance Program, also known as EAP, will also be provided by Cigna. HSA funding. The amount Natural Grocers contributes will be increasing to $30 a month. What's not changing? Vision coverage will continue with Vision Service Plan, also known as VSP, and we will continue to offer supplemental benefits with AFLAC. And those enrolled in the previously provided medical PPO option will continue to be grandfathered into that plan. If you change to the high deductible plan during open enrollment, you will not be able to move back to the PPO plan in the future. Let's go into more detail about our benefit plans. Our medical plans for 2020, as mentioned, are moving to Cigna. However, there are no changes to the plan design. During this presentation, we are going to talk about the high deductible medical plan. If you are grandfathered into the PPO medical plan, you should have received a benefits guide with the plan details, and you may access a summary of your benefits online through the HRIS. Please also feel free to reach out to us with any questions. The in-network benefits provide preventative care at 100%. The annual deductible is $3,000 for an individual and $6,000 for a family. Coinsurance is 80% after the deductible is met. Out-of-pocket maximum is $6,000 for an individual and $12,000 for a family. I'd like to give you a quick reminder about how our high deductible plan works. Your preventive care services, such as your annual checkup, preventive medications and immunizations, well child visits, and certain preventive cancer screenings, are covered by Natural Grocers at 100%. This means you pay $0 out of pocket for these services. For non-preventive services, such as medical visits for an illness or injury, surgery, and other prescriptions, you will be responsible for paying the full cost out of pocket until you reach that deductible. Please remember, the cost to you are discounted prices if you use an in-network provider. Once you reach the deductible, Natural Grocers covers 80% going forward. The most you will pay in a year is the out-of-pocket maximum. This does include the deductible. As mentioned earlier, the company will be funding $30 per month into your HSA. We will talk more about the HSA and how it works later in this presentation. Please note you should stay in-network to receive the greatest benefits. Out-of-network services have a separate and higher deductible, lower coinsurance, and higher out-of-pocket maximum. This slide shows the medical premiums for 2020. Even though medical and insurance costs continue to rise, we are excited to be able to keep rates the same for the new year. Premiums are deducted from each biweekly paycheck on a pre-tax basis. In months with 3 pay dates, deductions are only taken from the first 2 pay dates of that month. For 2020, this will occur in March, August, and December. Our 2020 dental plan will remain the same as the 2019 plan, and as mentioned, it will be moving to Cigna. Preventative diagnostic services such as a cleaning, oral evaluation, x-rays, lab tests, and fluoride are covered at 100%. The annual deductible is $100 for an individual and $200 for a family. This does not apply to preventive and diagnostic services. Maximum benefit paid is $1,500 per participant per calendar year. Basic services such as restorations, fillings, extractions, oral surgery, periodontics, endodontics are paid at 80% after the deductible is met. Major services such as inlays, onlays, crowns, dentures, and removable prosthetics, fixed partial dentures are paid at 50% after the deductible is met. Out-of-network benefits provide the same coverage, however, they are subject to usual, customary, and reasonable rates. If a provider charges more than those determined rates, you may be billed for the amount that is above the usual and customary rate. This slide shows the dental premiums for 2020. They are also unchanged from 2019 and will only be deducted from the first 2 pay dates in a month. Our vision benefits are provided by VSP. The in-network benefits provided include a well vision exam for a $10 copay once per calendar year, prescription glasses for a $25 copay, frames are provided every other calendar year, and you receive a $130 allowance or a $150 allowance for featured frame brands. Any amount spent beyond the allowance amount, you receive a 20% savings. Lenses are provided every calendar year. They are included in the prescription glass copay. Receive single vision, line bifocal, and line trifocal, and polycarbonate lenses for dependent children. Lens enhancements are provided every calendar year. Scratch-resistant coating is for $0. Standard progressive lenses, $0. Premium progressive lenses, $95 to $105. Custom progressive lenses, $150 to $175. Contacts you can receive instead of glasses every calendar year. Again, the $130 allowance is provided and a copay does not apply. However, there is a contact lens exam that could cost up to $60. Some additional benefits provided under the Vision Plan include a Diabetic Eye Care Plus program for services related to diabetic eye disease, glaucoma, and age-related macular degeneration. These services can be provided for a $20 copay. Some additional savings include a 20% savings on additional glasses and sunglasses, including lens enhancements from any VSP provider within 12 months of your last well vision exam. Retinal screening, no more than a $39 copay on routine retinal screening as an enhancement to the well vision exam. Laser vision correction. You can receive an average of 15% off the regular price or 5% off the promotional price. Discounts are only available from contracted facilities. This slide shows the vision premiums for 2020. Premiums are deducted from each biweekly paycheck, and in months where there are 3 pay dates, deductions are only taken from the first 2 pay dates of that month, March, August, and December. Again, rates are not changing for the new year. Health Savings Accounts, or HSAs. If you enroll in the high deductible medical plan, you may also enroll in the HSA if you meet all eligibility requirements. The company will contribute $30 per month to your HSA. You may also contribute your own pre-tax money through payroll deductions. You may change your contributions at any time throughout the year. Use your HSA funds to pay for health-related expenses, including medical, prescription, dental, and vision claims. No use it or lose it rules. Unused funds remain available indefinitely, even if you leave the company or the plan. Funds can be saved long-term for retirement, and funds can be invested once you have a minimum of $2,000 in your account. There are annual contribution limits that apply to an HSA. The 2020 contribution limits are $3,550 for an individual, $7,100 for an individual plus one or more dependents. Our HSAs are managed by Optum Bank. If enrolling in an HSA for the first time in 2020, the Benefits Department will send you information on how to initiate your Optum Bank account setup. You must set up your Optum account in order for any contributions to be funded. You can also manage your account at www.optumbank.com. Flexible spending accounts, or FSAs, are provided by WageWorks. FSAs allow you to contribute pre-tax money to pay for qualified expenses. There are three types. Healthcare FSA. Contribute up to $2,750 per year to pay for eligible medical, dental, and vision expenses. You are not able to utilize this account along with the health savings account. Limited Purpose FSA. You're able to contribute up to $2,750 per year to pay for dental and vision expenses only. You're only eligible for a limited purpose FSA if you are enrolled in the high deductible healthcare plan. Pairing a limited purpose FSA with your HSA allows you to set aside money specifically for dental and vision expenses, so you have more in your HSA for medical expenses. Dependent Care FSA. Contribute up to $5,000 per year to pay for qualified dependent daycare costs. This is a use it or lose it plan. Funds must be used by 3/15 of 2021, and claims must be submitted by 3/31 of 2021, or your funds will be forfeited. Life and accidental death and dismemberment, or AD&D coverage, is provided by Cigna. Natural Grocers automatically provides $25,000 in life and AD&D coverage at no cost to eligible crew members. Additional coverage can be purchased for yourself, your spouse, or your children. For employee coverage, the guarantee issue amount is $150,000 if you're under the age 70. For spouse coverage, this is $25,000 if your spouse is under the age of 70. Employee life. Coverage can be purchased in increments of $10,000 up to $500,000. Spouse life. Coverage can be purchased in increments of $5,000 up to the lesser of $100,000 or 100% of the employee coverage. You must also be enrolled in voluntary employee life coverage to purchase spouse coverage. Child life. Coverage can be purchased in the amount of $5,000 or $10,000, and again, you must also be enrolled in voluntary employee life to purchase child life. Only during this open enrollment period will previously eligible crew have an opportunity to elect voluntary life benefits up to the guarantee issue amounts without having to complete a statement of health. Disability benefits are also provided by Cigna. Natural Grocers automatically provides short-term disability, or STD, benefits to full-time crew members at no cost. STD benefits provide income replacement should you become disabled and not able to work. Benefits begin on the 8th day of disability, which is a shortened wait period for 2020, and provides 60% of your weekly earnings up to a maximum of $1,000. We also provide a voluntary long-term disability plan, or LTD. Crew members can purchase LTD coverage. Cost for coverage depends on age and will be displayed during the enrollment process. After STD is exhausted, LTD benefits pay 50% of your monthly earnings as income replacement up to a maximum of $5,000 per month. The low plan covers up to a 5-year disability period. The high plan covers up to your normal retirement age. Only during this open enrollment period will previously eligible crew have an opportunity to elect voluntary LTD without having to complete a statement of health. The Employee Assistance Program, or EAP, is offered through Cigna. All crew members, full-time and part-time, and eligible dependents are automatically enrolled. The plan offers up to 3 free counseling visits per incident, emotional wellness programs, 24/7 nurse line, free will preparation, legal and financial consultations. To access the benefits, please visit the EAP website at www.cignalap.com or call 1-800-538-3543. Cigna provides many tools for members to help navigate the world of health insurance. One such tool is Cigna One Guide. Cigna One Guide service helps you make smarter, informed choices and get health-related recommendations based on what matters most to you. It's their highest level of support that combines the ease of a powerful app, the web, and live service via phone or online chat. One Guide personal support, tools, and reminders can help you stay healthy and save money. Help from your One Guide team is always just a phone call or click away. Nothing is more important than your good health. That's why there's My Cigna, your online home for assessment tools, plan management, medical updates, and much more. On My Cigna, you can find in-network doctors, dentists, and medical services, view ID card information, review your coverage, manage and track claims, order refills or talk with a pharmacist at Cigna Home Delivery Pharmacy, use their prescription drug price quote tool to compare real-time drug pricing specific to your plan, take your health assessment, compare cost and quality information for doctors and hospitals, access a variety of health and wellness tool and resources, sign up to receive alerts when new plan documents are available, and track your account balances and deductible. You can also access MyCigna on the go by downloading the MyCigna app. Call the 24-hour health information line 24 hours a day, 7 days a week to speak with a nurse who is ready to provide information and help answer your health questions. This toll-free number is printed on the back of your Cigna ID card. Get information to help you decide where and when you should get treatment, need general health information, or have a specific health concern. You can also listen to hundreds of podcasts to help you stay informed about your health. Select a topic and download podcasts to your mobile device or listen via live stream on your computer via mycigna.com. You can use telehealth for 24/7 care. Cigna Telehealth Connection lets you get the care you need, including most prescriptions for a wide range of minor conditions. Connect with a board-certified provider via phone or video chat when, where, and how it works best for you. It's available 24/7, 365 day or night, including weekends and holidays. And it's available by phone or video chat. Cigna provides programs and digital tools to help improve emotional well-being. Services to help individuals manage life events, as well as 3 face-to-face visits with an EAP counselor, live chat with an EAP consultant, unlimited telephonic counseling, and access to work-life resources. iPrevail provides on-demand peer coaching and personalized learning plans based on proven cognitive behavioral therapies. Individuals use a chat function to pair with a trained peer specialist who has faced challenges of their own with depression, substance use, and other challenges. Individuals engage with peer coaches or work through learning sessions and activities on their own. Happify is an online self-guidance tool helping to increase resilience by engaging the customer in different tracks with different goals, such as overcoming negative thoughts, coping better with stress, overcoming insecurities, and building self-confidence. The tracks include articles, science-based activities, and games that guide individuals to see more positive aspects of daily life. The Community Support Program helps with food, housing, financial, and other needs. Getting and staying healthy is important. That's why most health plans include coverage for eligible preventive care services at no additional cost to you when you receive them from a doctor who participates in your plan's network. This means no money taken from your account and no out-of-pocket costs to you. Covered preventive care services can include, but are not limited to, screenings for blood pressure, cholesterol, and diabetes, screening for colon rectal cancer, clinical breast exams and mammograms, and pap smears. Natural Grocers offers supplemental voluntary accident and hospital coverage through AFLAC. The hospital indemnity coverage pays you cash when you are hospitalized for a sickness or accident. Some of the plan highlights include hospital admission, you receive $500, hospital confinement, $100 per day, hospital intensive care, $100 per day, hospital intensive care step-down unit, $50 per day. And you can also receive $50 for completing an annual health screening. The accident plan pays you cash if you are injured in any sort of accident. Some of the plan highlights include hospital admission, you would receive $625, hospital confinement, $150 per day, ER urgent care, $100 plus $25 if an x-ray is taken, burns, $50 to $10,000, fractures, up to $2,000 based on a schedule, ambulance, $200 for ground, $600 for air, and dismemberment, $6,250 to $12,500 depending on the loss. AFLAC provides some added services included in the accident and hospital plans. They provide telemedicine, which is access to medical care 24/7, 365 days a year. You'd meet with a board-certified U.S. licensed health provider, and consultations are done by phone, webcam, or app. There is a $35 flat medical fee, and you can receive prescriptions, referrals, and more. They also have a medical bill saver to help negotiate medical bills not covered by health insurance. This is for bills that are more than $400, and they contact your provider to negotiate discounts. You would receive an easy-to-read personal savings results statement summarizing the outcome and payment terms. You also have access to a health advocate 24/7, where you can find doctors, dentists, specialists, hospitals, and other providers, can schedule appointments, treatments, and tests. They can help to coordinate benefits and help transfer medical records, x-rays, and lab results. While our 401k plan is not part of this open enrollment process, it's important to mention this benefit. As discussed earlier, all crew who are 21 and older are automatically enrolled in our 401k plan. Crew may log on to their account at www.401k.com at any time to opt out or change their contributions. The 2020 IRS contribution limit is $19,500, and the limit for crew age 50 plus is $26,000. Natural Grocers offers a discretionary employer match. If you contribute to your 401k account during the year, you may qualify for the discretionary match. The match is calculated and announced on an annual basis. As previously communicated, we are excited to announce that Natural Grocers will be providing a discretionary match for 2019. The match will be 25% of the total amount you contribute into the plan for the calendar year up to a maximum of $2,500. You must be an active crew member as of 12/31/2019, and the match will post to accounts within the first calendar quarter of 2020. Again, our open enrollment period will begin Monday, November 11th and go through Friday, November 22nd for benefits effective 1/1/2020. Who needs to enroll? Anyone who wants to add, change, or cancel any benefits, dependents, etc. Anyone who wants to enroll in an HSA or FSA for 2020, as those plans will not roll over. With the exception of HSA and FSA elections, current benefit elections will automatically roll over into 2020. Even though we are moving carriers, those benefits will carry over into 2020 if no action is taken. Crew members who are newly eligible for 1/1/2020 benefits may enroll during the open enrollment period or through their new eligibility session. Separate instructions will be sent to all newly eligible crew members. Enrollment is done online through the UltiPro HRIS, and you will have detailed instructions included in the Open Enrollment 2020 guide. The website is https://n24.ultipro.com, and once you're logged on, you'll go to Menu, Myself, Open Enrollment, and you'll click on the 2020 Open Enrollment link. Some important reminders. FSA is a use it or lose it plan. You have until 3/15 of 2020 to use your 2019 FSA funds. WageWorks must receive your request by 3/31 of 2020. Any money that is not used will be forfeited. Remember that your HSA funds do roll over from year to year, so you do not have a deadline to use those funds. Review your beneficiaries and dependents, address, and other contact information in HRIS. Open enrollment is the perfect time to ensure your beneficiaries and dependents are correct. You can make changes during the open enrollment process. Please also make sure that your mailing address and other contact information is correct to help ensure you receive insurance cards and important company mailings. Again, you can log in at https://n24.ultipro.com. And to change your address, go to Menu, Myself, Personal, and then select Name, Address, and Telephone. Please feel free to reach out if you have any questions or have any problems arise while you're going through the open enrollment process. If you have any benefit-specific plan questions and you would like to reach out to Cigna directly, they do have a pre-enrollment support line set up for us. That number is 888-806-5042. You can also contact your benefits team at 303-986-4600 at extension 80832 or by email at benefits@naturalgrocers.com.